Here I am at the Baptist Neighborhood Hospital, which is a freestanding emergency room. I'm here today with Melissa Laster. Hi, Melissa.
Hi.
Tell me what happened.
Well, I'm here to talk about a grossly overpriced medical bill that we received. Back in May, we brought our daughter Genevieve here because we thought she might have an appendicitis. She was having severe abdominal pain, and so we brought her to the ER, and they got us right in, and we were only here about 3 hours. But when we received the bill, it was over $2,000 for a few hours and a bag of saline and an IV and then some blood work that was done. So we were very surprised about the cost of that because we have health insurance as well. So we asked for an itemized statement, and that's when we decided that these charges were grossly overpriced and that they were taking advantage of us.
So you said you had insurance. Did they pay anything towards this bill?
No, our insurance did not pay anything. We have a pretty high deductible, so.
Okay, so you're self-pay, in other words.
Yes, sir.
Okay, so how much did you expect this would cost you?
Well, whenever we were leaving to check out, we paid a $200 down payment, and they estimated our cost at about $800. Which is doable. It's difficult for us in you know, our situation. I'm a stay-home mother, so but I was able to put $200 down, and then when we received the bill, it was over $2,000, and so that was a unexpected surprise.
That is unbelievable. It really is. I just, it's hard for me to get my head around that kind of a bill of $2,500 for 3 hours, and they didn't do any CT scans.
No.
They didn't do an MRI scan, no ultrasound, nothing, just an IV and some laboratory work, right?
Yes, some lab work too.
Okay, so that sounds incredible. Did you call and complain, or did you see if the bill was right, or did you find out if there's any way you could get some help?
Yes, so we did. The billing department called us, and I asked for an itemized statement, and at that point when they called back, I told them that we would be disputing it because we thought that these were just outrageous prices for something that we know wouldn't have costed this much. So then at that point I called the Baptist Patient Relations Center, and I had talked to them 3 different times on voicemail, and I didn't receive a call back.
Incredible. Okay, let me just look at this. First of all, I'm not new to the Baptist hospital system. I'm an emergency doctor. I worked for the Baptist Hospital emergency room for over 30 years. I treated 130,000 patients. Back then, the Baptist hospital system was a charity hospital, not for profit, and I saw over 25,000 patients free of charge. Back then, people like Genevieve, like Mrs. Laster's daughter, would have been, the mission would be to help people like that. But in 2003, Baptist was sold to Vanguard. Vanguard later sold it to Tenet in 2013. So now this hospital is nothing more than for profit. Everything they do is trying to make money. Well, as an emergency doctor, I can tell you that the emergency room is the greatest money generator for the hospitals. I know that because I was chairman of the emergency departments of the 5 Baptist hospitals here for over 10 years, the chairman. I was on the executive medical committee as well, so I know what these charges are all about. So let's look at these charges. Let's look at what was sent to Ms. Laster. These are some of the bills that they sent. They itemized these, so let's look at these. I think the interesting one is the bill for just walking into the emergency room. The first one is $4,214 just for walking into the emergency room. Now, the average pay by Medicare and Medicaid is $420. $420 versus $4,214. But that's nothing. Let's look at the laboratory. This is very interesting. If you look at the laboratory, the first thing on the laboratory that was, you may be able to see this. The first thing was the complete metabolic panel. Now I can understand why they do that. It has things like creatinine, electrolytes, glucose, BUN. It has all these different tests on it. So their cost, their bill for the complete metabolic panel was $4,388. Now, I get those exact same tests run at Quest Diagnostic Laboratories here in Bulverde, Texas. As a working physician, I get those exact same tests for $6.75. Now, did you hear that? The difference between $4,388 versus the real cost of $6.75. Now, they did some other tests. For example, CBC, complete blood count, at $476. At Quest Labs, they cost $5.88. So the total laboratory bill from Baptist Neighborhood Hospital was $6,950, almost $7,000 for the lab. The exact same test run at Quest Labs right down the road is $92. So $92 versus $6,950. The grand total that they sent to Melissa for the emergency room care was $13,648. As I can see, the actual charges should have been $548. Now, what they did is something right from straight from the handbook of shysters. Okay, they said, okay, your bill is $13,000. We're going to give you an $11,000 discount. Great. So they gave her $11,000 discount, so her final bill was $2,523. Now this is just like I'm selling you this flashlight. I'm going to charge you $10,000 for the flashlight. But today, if you want to buy it today only, I'm going to sell it to you for $1,000. You are going to save $9,000 by buying this flashlight today. It cost me $1 at Walmart. Do you think we're that stupid? Do you think the people and the customers and the patients that come to this hospital are that stupid to understand that a $11,000 discount from a $13,000 bill for a 3-hour stint in the emergency room, that's honest? It's price gouging. Another study done by Mira Healthcare Cost Analysis in April of 2022, just a few months ago, said in Texas, the total ER charges for level 4, which was her daughter's level, would be at the maximum of $870. So you can see what they're doing here is something egregious. It's something that I'm ashamed of, and everybody should be ashamed of it. What would you take? What would you think would be something fair for you to pay at this point?
We would have been fine paying the $800 that we were quoted at the beginning, but when we said we would not pay the $2,300 over the $200 that we already paid, they said they would send us to collections. So then we would be.
So you're going to go to collections.
So we'd go to collections. Mm-hmm.
So I agree. They quoted you about $800 estimate, and there's a thing about surprise billing. There's a new law that they can't charge you more than $400 from what they quoted you, but they did. They didn't care. Now, the other thing that I look at, and we should all be concerned about this. Medicaid patient comes in and they accept the $420 complete payment for the emergency room. Okay, since they're hardworking people, they expect them to pay $2,500 so they can pay not only for themselves, but they're paying for 5 other people. Is that fair? Is it fair that they charge them 5 times more for their care than a person that comes in with Medicare or Medicaid? I don't think that's fair at all. So, call to action. Call to action is here. I want every one of you who is concerned about this, upset about this, to put this video on your social media, Facebook, Twitter, Instagram, LinkedIn, put it everywhere. We're going to do something about this, ladies and gentlemen. I want you to join with me and join with Melissa Laster to put a stop to this egregious practice of overcharging patients when they have an emergency and they have no other recourse. Thank you.